Welcome to Coconino County. This presentation will go over your medical, dental, vision benefits. Coconino County's benefits are managed by the Northern Arizona Public Employees Benefit Trust, which we call NAPEB. The plan year for our benefits start July 1, 2020 and go through June 30th, 2021. The NAPEB Trust also manages our benefits for these other 6 entities. Benefits eligibility. To be eligible for benefits, regular status employees must work a minimum of 30 hours per week, and temporary status employees that meet the Affordable Care Act eligibility may also be eligible for benefits on a case-by-case basis. The effective dates of your benefits will be the first of the month following a full month of employment. An example is if you're hired on January 2nd, you must wait the full month of February, and then your benefits will be effective March 1st. There is a waiving period waiver. If you are rehired with benefits eligible employee within the Coconino County in the last 12 months, you may waive your benefits, or you may meet other requirements for rehire policies. And if your benefits eligible with another NAPEB employer, like the city or the school district, within the last 31 days, then you also have a right to waive the waiting period. Once you select your benefits will remain through the remainder of the plan year. You may make changes to your elections in 2 cases: during open enrollment, which happens once a year during the month of May, and those changes will be effective July 1st. Or if you have a qualifying life event in the middle of the year, you may also be able to make those changes. Examples of qualifying life events are marriage. If you're married, you can add your spouse. If you go through a divorce, you may remove your spouse. You have a child or you adopt a child, you may add the child. Or if one of your dependents loses coverage through another employer, then you may add them as your coverage. These are some examples of qualifying life events. However, you must make these changes within 31 days of the qualifying life event. The enrollment window for new employees is the first 2 weeks of employment. All employees are automatically set up with the default benefits, which are the medical, high deductible health plan, employee only, with no employer contribution to the HSA or FSA account, the dental base plan and the vision base plan, employee only. These benefits will be there, and if you don't enroll in the first 2 weeks, you will automatically keep those default benefits. It's important for you to know. We're going to go over the medical prescription plans. Blue Cross Blue Shield is our provider, and CVS Caremark is our pharmacy provider. And there's a phone number there for Blue Cross Blue Shield in case you have questions about your plan. These are the 3 medical plans that we offer: the bio plan, the base plan, and the high deductible health plan. This is a good chart for you to look at to do some comparisons to the plans when you're making your elections. You can see on the top, it is the deductible. The first portion is for employee only coverage, and the second portion is for family coverage. These are the deductibles that must be met for certain services that require you to meet the deductible. You can also compare the copays within each of the different plans. So this is a good chart for you to review before you make your selections. More information about our plan benefits. The deductibles are based on a calendar year, January through December. However, our benefit plans are based on a fiscal year, July through June. Something to be aware of when you're planning and using your services is to know that the deductibles run on a different year. Dual spouse deductible coordination. This is talking about if you have a spouse who works for another NAPEB employers, for example, the city or the school district, only one spouse must have the family coverage. They both cannot have the family covered under them. Flu shots can be free. There's no copays for your physician's office or at the pharmacy, or also at the Vera Whole Health Clinic. So these are free services that are offered for flu shots, and we highly recommend people to get their flu shots since they are free. Member ID cards. You will get 2 cards for your medical coverage. One will be from Blue Cross Blue Shield of Arizona, and the other will be from CVS Caremark that's specifically for your prescriptions. So we just recommend that when you go to the doctor, you take your medical card, and when you go to the pharmacy, you take your CVS Caremark card. 2 separate cards for 2 separate purposes. You also have an option to waive your medical coverage. Verification of other qualified coverage is required. So in order for you to be able to waive your coverage, it cannot be a group health plan that is through another NAPEP employer. It cannot be a marketplace health plan either. The ones that do qualify is if you have Access, TRICARE, Indian Health Services, or Medicare, then you have a right to waive that. And you will need to submit a waiver form and proof of other coverage to waive your medical benefits. You're not allowed to waive the dental or the vision, just the medical. Other great services that are included in our plan is the Mayo Clinic in Arizona and the Cancer Treatment Centers of America. We hope you never have to use these. However, they are a great service that are part of our in-network provider on all of our plans, which is great. And this is the medical cost table. So this will break down the cost of the different plans. Again, good for you to look at and compare so that when you make your selections, you choose the right plan for you. Your cost will be the middle section highlighted here in orange because you are a new employee. In the future, you may be eligible to get the discounts on the right side, which are for incentive points that you have an opportunity to earn this coming year. But since you are new and you haven't had that opportunity yet, the orange section in the middle will be your cost. The first portion is the employee-only portion, and the bottom is the family coverage. Family coverage can be various of dependents. It could be just a spouse, it could be just the children, or it could be spouse and children. All of those are considered family coverages, and you can see at the bottom the total cost for that on a monthly basis. For the high deductible health plan, as you can see here, it is free, no cost to you, and the high deductible health plan comes with a health savings account, which contributions get put into. So if you select employee only, the county will contribute $55.48 a month into the health savings account. And again, these levels are if you earn points next year. There are some cases where you may not be eligible for a health savings account. That is if you are entitled to Medicare, if you're covered under another non-high deductible health plan, or if you are enrolled at Access, TRICARE, Medicaid, Indian Health Services, then you will not be eligible for a health savings account, and you will be automatically enrolled in a flex savings account, which is a little bit different. It is a limited account. And this is the cost for that. So for the FSA account, if you do not match the contributions and you choose not to put anything in there, then you will get a maximum of $500 in there, and the remainder of the maximum will be paid out in taxable income. More information on the health savings account. It is associated only with the high deductible health plan. So if you're not enrolled in the high deductible health plan, you're not eligible for this account. The HSA account reduces your tax liability. The maximum limits for this is $35.50 with single coverage, and if you have family coverage, it's $7,100 per calendar year. And this is a combination of employee contributions and the employer contributions combined. They cannot reach the maximum of this. Employees that are age 55 or over have an opportunity to make a catch-up contribution of $1,000 per year. The HSA funds can be used for medical, prescription, dental, and vision expenses. Any unspent contributions at the end of the year will roll over. You will not lose your money. And you can take your HSA account with you when you leave employment or when you retire as well. It can also be used to pay for COBRA or Medicare or long-term care premiums. And you never pay taxes when you use it for qualified expenses, so it's a tax-free benefit. this account. When your balance reaches $2,000, you can invest in mutual funds. You have the choice to do that. And Health Equity Portal allows you to view and manage your claims and see how much you owe and process payments. That is a provider that will manage this for you, and you will get a card from Health Equity. So you can go to the website here at the bottom, healthequity.com, and it will give you a lot of information on the health savings account. It'll also be able to tell you what qualified expenses count towards this that you can use it for if you have questions. And there's a guidebook. So a lot of great information. It's a really good resource to go to if you have questions about HSA. Next, we're going to talk about our dental plan. Delta Dental is our provider, and there is a phone number there for customer service if you have questions. We have two plans that we offer, the Bio Plan and the Base Plan. On the right side, you can see the comparison of the plans, that the plans are very much similar. This, the routine services, basic services, major services, and orthodontia services are exactly the same benefit for both plans. The only difference is the maximum benefit per person that you get annually. For the base plan, you get $1,000, and for the Bio Plan, you get $2,000 annual maximum benefit. So that is the only difference between the two plans. And you can see on the left side the cost table, so you can make your comparisons when you make your elections. The employee-only base plan is free for employees. Next, we're going to talk about vision. VSP is our vision provider, and there is a phone number there for customer service if you have questions. We offer the Choice Bio Plan and the Choice Core Plan for vision. Both plans cost $15 copay to get an annual exam every year. And as you can see on the left side, you get a little bit more of a benefit on the Bio Plan. The Core Plan is mostly a 20% discount for prescription glasses and 50% discount for contact lenses. On the Bio Plan, you get a little bit more of a benefit in that you get some allowance of $150 for frames, and for contacts, $130 allowance. And in addition, you get 20% off discount as well. So you do get a little bit more of a benefit on the Bio Plan. And next, we'll go over the cost table. For the base plan, it's only for employees, and it is free, no cost. If you choose to add your family, you have to select the Bio Plan, and here is the cost for that. And all dependents for our plans are eligible up to the age of 26. For medical, dental, and vision, dependents can be in there up to the age of 26. Telehealth is another benefit that Blue Cross Blue Shield offers. It is a free benefit that is being a great service right now, especially with what we're going through right now with the COVID-19 crisis. There's three types of services: medical, counseling, and psychiatry services that you can do either on your smartphone, on your computer, or on your tablet. And these services right now are free for all plans. You can download the Blue Care Anywhere app and use it in that way. And it's a really, really great service that is very convenient right now that we strongly encourage you to use because it's free, and most people are using it right now. So. We also like to introduce you to the Vera Whole Health Clinic. It is a local clinic that is utilized for many, many services. And for the buy-up and the base plans right now, you get quite a bit of preventative care and primary care services for free. And for the high deductible health plan, there's an initial fee of $75 and then $50 for subsequent visits. They don't have walk-in appointments, so you do have to make an appointment. Here is their information, their address, and their phone number. And next, you will see what type of services they offer for free. Quite a bit. They have also have a great physical therapist there as well. So lots of these services are offered there, as you can see, quite a bit. So a great clinic that we like to let you know about that works closely with the NAPEP Trust. They work specifically with all the entities that are part of the trust. Okay. If you have any questions, please give us a call at HR 679-7100. Thank you, and once again, welcome to the county.